Hi, my name is T.lawson. I am an Auburn University MSN graduate nurse practitioner student, and today I am doing my presentation on psychosis. Psychosis is a mental disorder in which thoughts and emotions are significantly impaired. It is often seen in patients that are schizophrenia, schizoaffective, bipolar, depression, people that sometimes use substance abuse such as drugs, alcohol, street drugs, and even medical drugs, as they call. And some patients that have medical problems can suffer from psychosis, delirium, and some patients that have dementia can also suffer from some type of psychosis. You can also see psychosis in a patient that's been hospitalized for a couple of days, that's kind of out of their norm, and you will start to see them act a certain type of way. They'll be jittery, have racing thoughts, thinking that they are secluded, that maybe someone's trying to hurt them. I've seen a patient, I work in the ICU, I also seen patients that sometimes act that way if we keep them over a period of time. The risk factors associated with psychosis could be substance abuse, somebody that is abusing drugs or alcohol. It can also be a family history of psychosis, or also people that suffers from the lower economic system, and like the poor neighborhoods can suffer from some type of psychosis. I often read that it can also be genetic psychosis too. They said a child that's born with a genetic mutation known as 22q11.2 depletion syndrome is at risk of developing some type of psychosis. I just recently found that out on the NAMI website. I think that's the National Alliance for Mental Health. Also, the three main key questions that you would want to ask someone that comes into your office to see you, that you see that is kind of experiencing some type of psychosis. You want to see if it's non-life-threatening or life-threatening in physical harm or someone. So you would want to ask them, do they have thoughts of suicide? Depending on their question or their answer, that's how you proceed to the next question. And if they say yes, you would say, well, what is your plan? What do you have in mind that you want to do if you do have the time to take your life? And most of them will tell you if they have that trust in a relationship, and if you consider that life threatening, you will, immediately send this person to the ER. You will not do anything else. You don't pass go. You just send this patient straight to the ER to get seen. However, if they don't have thoughts of suicide and they don't want to hurt themselves, we establish that. You will also try to see what brings on the psychosis, what has changed dramatically in their lives, what's affecting them that they have a different mindset. Also, the three physical examinations that you will want to do. First, you will definitely want to do a mental examination, just to see where their disorganized speech. You can see their behavior. You can look at their thought process. You can see if they're thought blocking. You can look and see if they have a flat effect. You can also see a patient have some type of negative symptoms such as social withdrawal, lack of initiation, poverty, will definitely have that. And you can also see if they are actually having some type of visual or visual or actually hearing hallucinations. You want to pay attention to the focal neurologic system. You want to make sure they don't have any tardive dyskinesia or anything like that. You will also want to listen to their heart. You want to listen to their lungs. You want to check their nutrition, because some people don't want to eat and drink. You want to make sure that they are getting adequate nutrition to keep up their health. You also would want to maybe you can do some labs so you can run maybe a CBC, you can do a CMP, LFT, CSH, anything like that. Treatment would be antipsychotics. It's a whole range of them you can do, or you can also do therapy, get case management involved. You can get family support education involved, therapy, support education, and peer support for this type of person. Usually the prognosis is really good once they actually get someone involved and intervene before it gets too bad. Thank you. And